It's taken decades and millions of health workers traveling by foot, boat, and any other way they had to immunize children from polio. Health workers have even braved conflict to prevent a horribly crippling disease.
We've made tremendous progress working with community leaders, sometimes with military officials to help deliver vaccine to reduce the number of children that were inaccessible due to conflict down to very, very small numbers.
20 years ago, African governments committed to eradicate polio. Since then, 9 billion oral polio vaccines have prevented nearly 2 million cases of wild polio virus on the continent, according to the World Health Organization.
It took a lot of effort from many leaders, traditional leaders, religious leaders, and families, as well as volunteers and health workers who came together to make this tremendous feat possible.
The Global Polio Eradication Initiative provided funding and logistical support. This partnership involves the United Nations, Rotary International, the U.S. Centers for Disease Control and Prevention, the Bill and Melinda Gates Foundation, and Gavi, the Vaccine Alliance. The effort also involved a huge disease surveillance network to check sewage for the virus and test cases of paralysis. But Pandex says the work is not done.
It's important that community members continue to immunize their children against polio.
That's because polio still exists along the border between Pakistan and Afghanistan. Until the virus is knocked out of this region, children everywhere still need to be immunized. And children whose immune systems are weak sometimes get a type of polio that's shed from the vaccine into sewage. A different oral vaccine will be introduced next year to prevent this from happening. Dr. Pate hopes lessons learned from the effort to end polio will continue.
I hope that some of those assets that have been deployed in the polio eradication effort will then be used to hold on to the gains that we have made, not only on polio, but on routine immunization, to ensure that every child everywhere in the world is able to be protected from vaccine-preventable diseases.
The polio eradication effort demonstrates two things: that people around the world can come together to accomplish great things, and Dr. Pate says it shows that vaccines work. Carol Pearson, VOA News, Washington.